Hi, I'm Dr. Cosentino. We're at the Empire Medical Training Dermal Fillers Program, and we're going to inject Dr.
Maureen Zelinka.
Dr. Maureen Zelinka nasolabial fold area, and we're using today a product called Prevail Silk. Okay, this is a very good product, lasts about 3 months, and it has approximately 8 grams of hyaluronic acid in it. It costs approximately $120, and you're going to charge your patient about $450. All right, so let's start by doing a demonstration of the nasolabial fold area right here. She doesn't really need very much, but we're going to work on that area. So everybody take a look at it. This is the product here. It almost looks like it's just filled with air. All right, but this is your viscous gel inside. As you notice, there's always a little air bubble in there, and you have to push that through once you attach the needle. It comes with a 30 gauge needle. Okay, so let me just take a moment to explain this to you. It comes with a 30 gauge needle. Obviously, they want you to use a 30 gauge needle. You could use the 30 gauge needle, or you can use a 27 gauge. I like to use the 27 gauge because it's a little bit easier to work with. Do you have one over there, Bill? Thank you. Perfect. Thanks a lot. All right, but they're recommending that you use a 30 gauge. Again, I like the 27 because you have a little bit more control, and it's not as difficult to push it through the syringe. All right, make sure you put the syringe on, or excuse me, the needle on nice and tight. If you don't, and you start to squeeze it out, the whole thing's going to pop out, and that actually happens sometimes as well. Okay, try to get rid of your little air bubble, right? You don't want to inject an air bubble into somebody. Okay, next is you alcohol the area, and doctor, if you could close your eyes so I don't burn your face, your eyes. I'll tell you when you open your eyes. I want to dry it off a little bit too.
I'm fine.
Okay, good. All right, so the important things now when you're injecting this area is, again, the depth is important, the speed, and things like that. Okay, so remember we were talking earlier. If you hold the needle in the syringe like this, it's going to be difficult to get the correct depth. And I see people holding the syringe and a needle like this. So try not to hold it like this. If you hold it like this, you know, you might be able to get it correct, but chances are you're going to be a little too superficial. If you hold the syringe and needle the traditional way, the correct way, almost by default, you're going to get the correct depth. Okay? Almost just naturally, you're going to be at the correct depth. The next thing that I like to do is you're going to pull down on the skin a little bit. Okay? You're going to pull down because you want the skin to be somewhat taut. All right? And you're going to go right into this area. Don't do this to the person, okay, because the dosage is visual, okay? It's a visual thing until you get results. Now, we can work on this area if somebody also wants to work, and she's going to be very happy with this. We can inject right in here, you know. Do you want me to do that?
The marionette?
Yeah, and it will eliminate this completely as soon as we do this. But for now, let's just start with the nasolabial fold. So turn a little bit this way. Okay, so you hold it like this. I like to kind of support my hand with with the fingers on the bottom. And that's it. Okay, that was it. That's the whole procedure. Pretty simple so far, right? Can you guys, if you zoom in kind of closer, you can. I didn't do very much, but you can see the result, right?
Yeah.
So what I like to do now is I go to the other side. Okay, so let me just bring my chair over here a little bit. Can you pull your hair back? Yeah, that's it. And the more over here too? Yeah, that's it, thanks. Perfect. Hey, can everybody see that okay? And try to stop injecting before you pull out, okay? Because you'll waste the product for one. Look at see the nice result right there? Okay, now this of course has lidocaine in here. So the reason why I like to start from one side, then go to the other, the lidocaine is starting to work on this side, then the lidocaine is working on this side. We're actually almost done.
Yeah, you can feel the lidocaine.
Yeah, you can feel it? Okay, good. So right now we did about...
I feel it burn going in. And now it's...
Okay. We did a little bit more than half. So I'm going to do it one more time, and then the remaining amount I'm going to ask her and see what else she would like. like what area in case we missed a spot or something. So take your time. It's pretty quick procedure.
The results are amazing. See?
The results,
Very good.
Look at that. Yeah, it is, isn't it?
Really, it's amazing.
Look at that. Okay, let's do this side here. Bring your head up just a little bit. That's it, perfect. Have you ever had this before?
Mm-mm.
Yeah, you're going to like this. See, so the 27 gauge I think is okay. It's not much, a little bit thicker. Okay, so take a close look at that. Now, where's the mirror? Do we have a mirror around? Thanks, doctor. All right, so take a look at the mirror. Let me know if, really look at it closely. Usually in my office I have Lorena. Lorena, you want to leave the camera where it is? Just if you could come around, don't move anything. If you can move, doctor, don't bump that. And just take a good look. Here, come over here. And just, what do you think?
Yeah, maybe like a little bit more down here, but yeah, that one is perfect.
Okay, a little bit more on this side?
Yeah, right here, see?
All right, got it. Come on for a second. Okay, good, relax. Okay, put your head up a little bit. That's it. Okay. Nope, that's it, really. I'm going to put a little bit up here. Okay? Put a little bit more right up in here. Remember, you don't want to get too close to the corner of the nose. That's an area you definitely want to avoid. Okay, done. Good patient, too. Okay, make sure you don't let them leave. That's okay. No, that's okay. Make sure you don't let them leave any blood on their face. It's aesthetics, VIP type thing. You want them to leave really nice. So take, 30 seconds here and hold the gauze. Okay, and that's gonna look at that. She's done. Excellent. Good job. All right. Any questions just on this? Because the next thing we'll do is we're gonna do this area over here. Any questions on that?